This podcast is intended for educational purposes only. For more information and our full disclosure, please visit NC-MIDWIFERY.com and our podcast page. Well, welcome back to More About Birth. We have another episode with Shannon Bennett and Angie Hansen, your hosts. We hope that you enjoy this. Please subscribe, share this with your friends, and enjoy another episode of More About Birth. Hey, ladies.
Hi.
Hi.
Hey, we're going to talk about a topic today that a lot of people have really misunderstood. So, breastfeeding and natural child spacing.
Yep.
So the misconception is that if you're nursing, you can't get pregnant. Don't ever believe that. So there are rules to this game. If you choose to use breastfeeding as a means of birth control and natural child spacing, then you are most definitely going to want to pay attention today, because if you follow these rules, you will have great results. Mm-hmm. If you deviate from them, we don't guarantee it. So Angie is really passionate about this subject, so I think I'm going to let her just take off with it, and I'm going to pipe in when I want to say something.
Hang on,
Sounds
here we go.
good. Woo!
Did you use this method?
Yeah, we did, kind of unintentionally, but it just happened that way, and this was the way we wanted to raise our babies and care for our babies, and so in that style of parenting, it naturally delays your fertility. So,
well, tell us all about it.
yes, so natural child spacing. So this is sometimes called ecological breastfeeding, and it means that nursing is an effective form of birth control when you follow these guidelines, okay? And so there's 7 things listed here. They kind of overlap a little bit, but these are the guidelines, so I'm just going to read them. So, breastfeeding exclusively for the first 6 months. This means no food, supplements, bottles, or even supplementing with water.
What about pumping and bottle feeding instead of nursing at the breast? Does that count?
It's not the same, and we're going to get into that later,
Okay.
but it's not quite the same. You comfort baby at the breast, that's 2. No bottles or pacifiers, that's 3. Sleeping with your baby and nursing on demand at night. Napping once a day with your baby and nursing, during the nap or before. Avoiding.
That's just good for moms anyway.
I know, right? That sounds like a nice one. Avoiding schedules and not being separated from your baby very long. And along with that goes wearing your baby frequently. So baby's on you a lot. So these have to be followed fairly strictly to ensure this as a birth control method. But they are very effective. I'm going to read a quote in a second.
So can we pick each of these apart? Because I didn't use this as a form of birth control. So you know more about it than I do. When you talk about comforting the baby at the breast, are you going to get into all this, or can I ask questions now?
Yeah, ask. No, I wasn't going to define these super strictly.
But comforting the baby at the breast, does this mean anytime your baby is fussy, always try the breast first?
Exactly. Yep.
Instead of a pacifier?
Yep.
Okay. And then no bottles or pacifiers, ever?
Yeah. Honestly, I mean,
All in, right?
There's gray areas with that, but if you want to bank on this as your birth control, then yes, there's no.
If you want it 98% for sure.
Exactly, yeah.
Don't want 2 babies in 12 months.
Yep.
So sleeping with your baby and nursing on demand at night. You guys, this is the best way to get rest anyways.
It's so good.
It is the best way for both of you to get
It
rest. People worry about SIDS. My thought on that is, if you are not intoxicated with drugs or alcohol, your natural mommy alarms will be on alert as you sleep with your child.
Yep.
I'm a little leery of memory foam mattresses.
Yeah. Oh, yeah.
So it's good to have something firm under your baby. Mm-hmm. And if your baby were to stop breathing when it's snuggled up next to you, your breathing motions are just your natural fussing around in bed at night is going to jostle them back into a good breathing pattern.
Yeah.
So, nap with your babies. How about the schedules? Explain that one a little, avoiding a schedule.
So this whole thing is basically nursing on demand all the time, every time. That means mom doesn't decide, parents don't decide, the baby decides. You take all your cues from your baby. So there's no schedule, day or night, at all.
If
They're going to eat when they want, they're going to sleep when they want.
You want to pacify at the breast, even if they're not hungry.
Yeah.
So some babies, I know my babies would nurse and then they just wanted to lay there with their cheek on you, skin to skin.
Oh, yeah.
So tell me about the benefits of that, just the contact skin to skin, and wearing your baby, holding your baby, nursing your baby.
Yeah, definitely. So one of the things I was going to say about this whole program is, you know, it is a huge commitment. No lie. Like, it's a big commitment, but parenting in general is a big commitment. So there's a big, you know, effort that goes into this on the part of the mom and the parents, but the payoff is huge, ginormous, not just for your fertility. I mean, that's one of the things that delays your fertility, but it's so good for your hormones. So nursing, but not only nursing, just having your baby on you, with you, the skin to skin, it stimulates those hormones that make you feel better. They make you feel better about parenting. They make you feel better about your baby. I think it helps ward off depression and postpartum depression.
Definitely helps with the bonding process.
Absolutely. You're going to be more in tune with your baby. You're going to notice their cues and their cries much earlier.
There's a little relaxing hormone in there.
Yes. Yeah. Yeah, all of them.
So does this involve dads less then? Or would it be just, you're just going to handle the fussing when the baby
not at
starts
all.
to fuss?
Basically, this can be summarized also. It's called attachment parenting.
Right.
And dad is a huge part in this because mom can't or doesn't need to have the baby on her at all the time.
Right.
So instead of laying the baby down, dad holds the baby. Dad comforts baby. Dad can do skin to skin with baby. It's also great for the baby.
So it sounds like this would work great with this new modern generation where
Yeah.
more and more dads are more and more
Stay-at-home
involved
dads
in.
and-
Yeah. It's awesome.
Yeah, and so obviously for it to work as a birth control,
That would
mom
make it a
needs
little
to have
hard,
it
yeah.
most of the time. But again, for attachment parenting and just for the good of the baby, dad can always have baby on him when baby's not with mom.
And this goes along with the podcast that we did earlier on baby wearing.
Yes.
So
Yeah, I love it.
check out some baby carriers.
Love the overlap. Yeah. I really think that this style helps moms get more sleep. And honestly, I don't know if you believe that if you haven't tried it.
I would have gotten no sleep if my kids didn't sleep in bed with me.
Yeah.
None.
Yeah.
And I promise you, before they went to kindergarten, they all slept in their own bed. Nobody was nursing anymore.
Yeah. Yeah, no, it's great. Also, you know, they use this method in developing countries. It's been proven over time in studies. It's really effective. But the reason they do this is because not only do they maybe not have access to other kinds of birth control, it's so important in those countries and, you know, for anybody, for us too, but to rebuild mom's nutrition, to make sure that baby gets the full attention that they need and the full nutrition that they need. And this is a really proven way of ensuring that.
So the way that we do things in our modern era, it does not facilitate this type of parenting.
Nope.
Because we have moms having to go back to work. We have moms that don't live communally with family nearby anymore. And so they don't have any help with the other children. And they can't just sit and nurse and hold their baby all the time.
Yep.
So when we talk to our moms about making sure that there's someone there to take care of you, we're not kidding.
Oh, yeah.
We're not
For
kidding.
sure. Yeah, and we do want to say, guys, that if this isn't your method of child spacing, there's no,
no
shame
guilt.
in that. There's no guilt. This isn't like the end all be all. We just wanted to do this to put it out there because there are a lot of misconceptions, and it's an option. So if you're going to use breastfeeding as birth control or a natural child spacer, you just need to know that there's rules to that. It's not just nursing.
And it's some hard, fast rules.
They
I
are.
mean,
Yep.
Yeah.
Yep. So, along with that, Shannon, you want to give our big disclaimer? I hear her say this all the time.
All the time. You cannot rely on breastfeeding as a form of birth control. Do not rely on breastfeeding as a form of birth control. If you are not willing to have a baby when a baby comes, then you need to use some other form of birth control unless you are sticking to these rules like glue for 6 months.
Yep. Yeah, and the other thing is, I hear you say all the time, you can get pregnant before you notice that your fertility returns.
Because ovulation comes before the cycle.
Yeah. Yep.
And you won't know.
Yep.
Because you haven't had a cycle yet.
That's our disclaimer. But along with that, I'm going to read a couple of quotes from some really great books. This one is The Womanly Art of Breastfeeding. I'm sure a bunch of you are familiar with this.
And you know what? That is just one of my all-time favorite classic breastfeeding books in general.
Yep, it's amazing.
It's been around for years.
So we're going to talk here about Lactational Amenorrhea method, which basically means you are nursing to delay your fertility. So it says, can I get pregnant? If you want to avoid another pregnancy, the Lactational Amenorrhea method, or LAM for short, is 98 to 99% effective, about the same as the pill, in preventing pregnancy when all three of the following are true. Your baby is under 6 months old, and your periods haven't resumed, and you're breastfeeding exclusively without regularly receiving any other food or drink, including water. There's strong biological logic behind LAM. The baby who's getting all his food day and night from his mother isn't ready to share her. His mother's body isn't ready to take on a second intense job. If we fool nature by formula feeding the baby so that the mother's hormones don't know there is a baby, or if we train him to sleep through the night so that he routinely goes more than 6 hours without nursing, like an older baby, or if we give him a pacifier and reduce his time at the breast like a baby who's weaning, our bodies may assume it's safe to add another baby and pregnancy becomes possible. Even having a job during those first 6 months that separates you from your baby for a few hours a day reduces the effectiveness of LAM, because pumping is not as effective as a baby at suppressing ovulation.
Right.
So unfortunately, if you have to pump for whatever reason and go back to work, you really don't want to rely on this method, because it's the skin to skin,
Right.
it's the baby's mouth on the breast. It just does so much for the hormones. Right. It's a very different
It's pretty amazing that your body knows, when there's a baby there, and you don't get pregnant if you use these techniques. And if your body doesn't know there's a baby there, it's like it naturally goes back
God
into
thought of
being
everything.
able to. Yeah.
Exactly, yeah.
It's pretty amazing.
And again, you see this in the developing countries, in the cultures that do this. It's very effective. Like it said, as effective as the pill, which is amazing. It's really
98 to 99%. There really is no birth control. Even condoms and
it was way lower,
and even the depot shot. I don't think there's anything that's more than
in fact,
I was
on the
wondering
charts,
that too.
on the charts it was way lower.
Yeah. So there's really nothing that's the perfect solution outside of being
no sex.
Fixed. Yeah.
Sorry,
fixed. Actually,
yes.
That's not even.
Yeah, I know. True.
That is not even foolproof.
So,
I know many people who.
So you're saying no sex, then you are 100% sure.
That's the only 100% way.
So this quote comes from the Breastfeeding Answer book. It's this big giant book that we really like.
And just so you guys know, we'll put quotes and links to all of these resources, because we are quoting them right from the books, and we want you to be able to get the books.
Yep. It says, in many countries, breastfeeding has a greater impact on birth rates than all other contraceptives combined. The child-spacing effect of breastfeeding depends primarily upon the pattern of breastfeeding used. Because breastfeeding practices vary from place to place, the length of natural child spacing also varies. In some traditional societies, births are naturally spaced several years apart by breastfeeding alone. Breastfeeding's effect on fertility is nature's way of preventing a mother from having another child immediately, enabling her to give her full attention to the baby she already has and giving her body a chance to recover from pregnancy and childbirth. In developing nations, adequate child spacing can be crucial to the survival of both mother and child. And even though we may not be living in a developing country, every mama who's had babies really close together can say that while those babies are a huge blessing, it is harder on your body.
Harder.
You don't get a chance to recover. You don't get a time to rebuild that nutrition that the baby took.
And in my practice over the years, I have seen women that use this method almost completely. You know, they might not be doing absolutely every little thing, all 7 steps, but they're doing a darn good job of it. they will naturally have children 18 to 24 months apart.
And mine naturally were even much farther than that. So, yeah, in the developing countries, they're seeing them 3 to 4 years apart.
Wow.
The children from one birth to the next birth.
And they tend to nurse longer in the developing countries than we
much
do
longer.
here.
We're talking like 2, 3, 4 years.
Right. And we tend
not
to nurse
18 months.
here a year to 2 at the most.
Yep.
So is it true that there are some cultures that just seem to have more babies, being more fertile? It seems like there's some cultures where there's just, even here in the United States, there's certain groups of people that just seem to have baby after baby after baby. Is it fertility based?
I think it's more cultural than health based, really. Just practices.
Personal beliefs.
Huh.
Yeah. So one thing I found that was interesting about prolactin, which is the milk-making hormone, that's what's stimulated when you nurse, and the prolactin helps produce the milk. Dr. Sears on AskDrSears.com says that prolactin, the milk-making hormone that also suppresses ovulation, is highest between 1 and 6 a.m., which is super interesting. So that plays into you have to be nursing during the night. You have to be nursing frequently during the night. You don't want those long spaces because it suppresses ovulation.
It will tell your body to make milk and that it needs to keep making prolactin by nursing through the night.
So if you didn't nurse in the middle of the night, you would have less ability to produce, basically, is what you're saying?
Well, yeah, less prolactin.
You could have a lesser milk supply.
Wow.
Yeah.
And babies have their days and nights mixed up, is what we call it, when they're born.
Right.
And they nurse a lot at night and sleep more in the day. And it drives us nuts as parents because people are supposed to sleep at night and stay awake in the day,
Just
right?
lots of naps during the day, right?
Right. And this was from another source, but it says prolactin clears rapidly from the blood. So frequent nursing is necessary to keep levels high enough to suppress ovulation.
Did they mention what frequent is? Like every couple hours?
They didn't give it. It's on demand. But it's less than 4 hours.
Babies that are allowed to nurse when they want to nurse, because I ask this question at every postpartum visit.
Yeah.
Visit?
I
can't talk today. Every visit, clear through the final 8-week postpartum visit. And the answer that I get probably 99% of the time is my baby's eating every 2 to 3 hours if I'm letting them eat whenever they want.
Yep, exactly. And that honestly can continue for way longer than you probably would think. So it is a big commitment.
Some people don't realize how time consuming nursing is.
Yep.
They
for
just
sure.
have no idea. So this is a commitment.
It's a commitment. But, I was talking with a lactation consultant just a few days ago, and we were having this conversation about how I feel like a lot of people don't ever give this a shot 100%. And so they feel like they say, I've tried it and it doesn't work for me. But I'm saying, I don't think you have necessarily tried it 100%, because when you're doing it 100%, the baby senses that, you both get into a nice rhythm, and I think you end up being more relaxed and actually getting more sleep. But you have to do that 1,000% commitment to start seeing those really lovely benefits, I think.
Yep, I agree.
Okay, so let's talk about some things that would undermine ecological breastfeeding as a method of birth control, because we hear this all the time. We hear this a lot. I tried breastfeeding to delay my fertility in the past, and it didn't work.
I got pregnant. Yeah, I'm nursing a toddler and a newborn even through the night, and I still got my cycles back. So what's going on?
Yes. Well, again, for this to be effective, you have to follow all the guidelines. So a few things that are common that we see that people are nursing a lot, but they're still not doing these other things, and it's not going to work. So pacifiers and bottles are a huge one.
I see people go to the pacifier instead of the breast. If they fed the baby an hour ago, they're like, well, they can't be hungry.
Exactly.
So they just want to suck. Well, they probably do just want to suck.
Exactly.
And
that's not wrong.
No, and it's not wrong to give them a pacifier to suck. But if you're trying to use this form of birth control, it has to be at the breast.
Yep. Yeah, and because even the sucking stimulates prolactin, even if there's not necessarily they're getting a lot of milk, but
and just the skin to skin contact increases hormones.
Yep. So another one, not sleeping with your baby. The farther away you are from your baby, the less they are going to be stimulated to ask to nurse. So that's when they start sleeping longer through the night.
Thing.
And, you know, if you're needing sleep, you could just sleep right through it and not even notice. But when they're close to you, they smell mama, they smell that milk. It stimulates them to want to nurse more. So sleeping really close to the baby is really important.
We tell people right after the birth, have someone there to take care of you so that you can get a good 3-hour chunk of sleep.
Yeah.
While somebody is holding your baby, because you're so tired, you may just be totally passed out.
Right.
We're not intending that for a continuous thing, because skin to skin is great. But that gets you off to a good start.
Yep.
So do you feel like...
Wearing baby then helps too, even though it's not necessarily skin to skin during those times to make them...
they can smell you.
Absolutely.
They can feel your heartbeat.
They know that they're on mama.
Wow.
I've even had dads say, it's like... I can't do anything. In fact, you've said this to me before, Keith. I can't do anything.
Right.
If you're anywhere around, I can't soothe them. Obviously,
right. They know.
I've always said that as soon as you would leave the house and they would acknowledge it didn't matter what age they were.
Yep.
All of a sudden, it's like I became this necessarily the center of the world. But if you were in the room or in the building, I was not. I may not even be in the world.
That is just because when a baby's born, the mom and baby are not two separate beings. They are still a unit.
Yep.
Right. So do you think that's true with this new generation as much? That maybe because I see so many more men, it seems like they are in the center of the circle. Is that because of bottle feeding and everything else? Or do you think they would still have the same kind of bonding that's going on?
I think they're just taking a greater role.
Okay.
I think the men are just taking a greater
I do
role.
Too.
And they are
At least that's what I'm seeing.
Getting more skin-to-skin time with their babies.
Right. Which is great. And we're not here to say how you should run your family or anything like that. But
no, this is only if you want
it's just
to use natural child spacing
as
alternative.
Exactly. It's just a trend to notice that when nursing is the only option, it has these benefits and these side effects that go along with that.
Right.
So
no, we're not trying to put anybody down or try and convince you to parent this way.
It's just another option.
It's another option.
Absolutely.
And I don't know that people hear enough that when you buy in 1,000%, there's just huge benefits. And some people aren't able to experience those because of their home situation.
Or you don't have a desire to, and that is awesome. But if you want natural child spacing, these are the things you need to think about.
Yep. So being away from your baby for more than a couple hours, again, it's just that connection that stimulates those hormones. So even if, you're like, I want to go do a mom's day out or go have a little day retreat, that's fine. You just have to realize that it's going to start lowering those hormones that suppress your fertility. It's going to start telling your body to kick the fertility hormones back into gear. And it happens quick. So
I even see moms, like I had a mom call me just last week and she said, I'm spotting again. It's been like 10 weeks since I had the baby. What's going on? I said, how long's baby sleeping at night without nursing? And she said, 7 hours. And I said, bingo.
Yep.
Wow.
Start nursing more at night.
So interesting again that the contact with the baby, nursing the baby, is literally putting you on pause, right?
Of course,
That's crazy. That's
and
awesome.
that's the whole thing we talked about in the fourth trimester podcast, which we're always recommending to people to check out. But mother baby, it's a combo, and they're actually going to be more satisfied, and mama's going to be more relaxed and satisfied when you treat that fourth trimester as a continued connection, one unit.
Yes.
So again, pumping and feeding from that quote that we read, it's not the same. It doesn't work the same way.
It doesn't have the same hormonal cocktail as skin to skin.
Right. And then the longer sleeping at night, we talked about that.
Yeah.
So, at some point you are going to want to start introducing solids to your baby as they get older, right? And so a couple things you can do to start introducing solids but continue that delay of fertility. Always nurse before you offer the solids. That was your phone.
That was my phone. I
How
turned
rude.
it off.
And
Just kidding. I just didn't turn it off.
Just
once
kidding.
a midwife, always a
That's
midwife.
I'm
right.
on call.
Now our phone flashes her. Did you notice the strobe flashing?
I know.
Yeah, I know.
Okay. So,
Like seizure inducing.
yes. So nursing first before you give the solids.
Yep.
That's the thing. Introducing solids gradually. Little bits at a time, not like all of a sudden they're eating 2
Like
meals a
replacing
day.
a nursing with solids. You would want to not
Yes.
replace a nursing.
Right,
Is what you're
exactly.
saying.
Yep. And when you start introducing solids, the big thing again is to breastfeed at night unrestrictedly. So don't do those at the same time. Don't like start filling their nutrition with solids and then start spacing them out at night. It's just gonna
Right.
not be enough.
So did you share
Trigger
how long
ovulation.
that you can do this? I mean, how is there a limit to how many months out?
It's guaranteed for 6 months.
Okay.
But the research again shows that if you're doing these things, and even after you introduce solids, you continue doing these things, it's 98 to
go longer,
99% effective as a birth control method, which is the same as the pill.
And starting solids, just a side note, typically around 6 to 7 months for a breastfed baby is when you might start solids. But I see babies that are 11, 12 months before
My last
they're
did that.
interested in anything.
Yeah, we didn't even start trying until 9 months, and
They let you know.
she wasn't, and she was fat and gained and everything fine. So, yeah. If we were live and you were here with us, I would say, are there any questions?
Well, they can always put questions in the comments.
Yeah, we can answer
They
them.
can go to the website and leave us a question, and that's how you'll find the links to these different handouts. So.
Cool.
Yeah, and we are kind of going to wrap this up here,
Yeah.
but we have a little clip for you. Remember we told you about our what kids say?
Woohoo!
We did a home visit, and it was just so precious. The kids had not got to hear the baby's heartbeat. And so at the home visit, they asked if they could help listen to baby's heartbeat. And so we got a little clip of that for you.
And this is short, but it is sweet.
Aw.
Oh, it's fast. No, mommy moved it because Tiny's
I love that.
I said it was short, but that's a cute little clip.
They
there.
were really excited.
Aw.
And I think for our viewers, they get to see some of these behind the scenes things. That's just a precious moment.
Yeah.
I love
for
doing
sure.
home visits.
Yeah, it's
They're
special.
one of my favorites. In fact, I got to go do a home visit now, so we better wrap this up.
Sounds good. Thank you guys.
See you guys later.
We'll see ya.
Thank you, Shannon and Angie, for another great episode here on More About Birth Season 2. Thank you, our listeners, for joining us. Also, remember, it's available on YouTube. Subscribe to that channel. Share it with your friends and family. Thank you for joining us, and we'll see you here next time. This podcast is intended for educational purposes only. For more information and our full disclosure, please visit ncmidwifery.com and our podcast page.